Big FM podcast.
You are listening I Believe in IVF, presented by Emcure Pharma, powered by Materna.
We are presenting a unique patient awareness series by Emcure Pharma, I Believe in IVF, powered by Materna. Emcure is a pioneer in gynecologicals and preferred partner in IVF. But to make us understand about all this, we have a special guest with us. So, welcome to our show, Doctor. May I please ask you about your complete name, your designation, and the hospital you're working with?
Hi everybody, I'm Dr. Veronica Yeul. I'm a laparoscopic surgeon, IVF specialist and obstetrician in gynecology. I'm currently working with NHMMI Multi-Speciality Hospital and I have my own clinic in the name of Dr. Veronica Yeul Clinic.
So, Dr. Veronica, would you like to let us know that what are the unique services that you offer to your patients?
I am currently offering, like the name suggests, infertility practices. I also cater to obstetric and gynecologists. More so, I am predominantly doing a very specialized practice of gynec laparoscopy. That is the upcoming thing that is being done, and IVF. I am more closely related to bringing small joys to infertile couple in the form of their babies.
Wow, that's quite interesting. So could you please like to explain us what is IVF and what was the most challenging case that you have ever come across?
Well, every IVF case is a challenging. I would not particularly categorize that this was the most challenging because every couple is precious and every patient here, we deal the entire couple as a patient. Right? I mean, both the husband and wife need to be treated together to give them a baby because the gametes come from both. So, every case is special that we are handling. Every patient has some history to it, and more so, a very emotional aspect is attached to it that makes it more special. They are actually healthy people, but still come under the category of patients. So, that makes them more unique. Because they have been struggling to conceive over many years. There are patients who come with them with loads and loads of history. You will actually weep and cry if you will listen to their story, how much they have gone through. IVF predominantly, there are plenty of injections that they get, and it's, you'll find it uncomfortable to take those injections. But still, for the want of the gift that they get in the end, I mean, every couple is ready to take that. So, I feel every patient is unique. Every patient has a history to themselves. And likewise, any couple who is coming to me with a history of 9 years, 10 years infertility, or rather 1 or 2 years infertility, but unable to conceive, is unique to me.
Wow, that's such a beautiful line of yours that, they're ready to take that pain because of that bundle of joy which is going to be in their hands. But if I had to ask you, Dr. Veronica, why are the patients of IVF increasing in India? So what is the most common myth you have heard amongst the patients with regards to IVF?
Yes, definitely it is on the rise because as such, infertility is on the rise. Maybe I'll attribute it to several factors contributing to it. Education has gone up. So career options for couples have gone up. People are opting more for career. So girls are actually delaying their pregnancies to get established. Mm-hmm. One reason is that. Secondly, because there is a time framework when everything should be done. And people are delaying their pregnancies. So naturally, they get depleted of their eggs and these kind of problems come. One more thing is lifestyle.
And any kind of, you would love to give any recommendations on the lifestyle habits which needs to be changed in these days?
Have a good 8 hours of sleep at night. Sleep early, wake up early. Even if you are sleeping late, at least have a proper 8 hours of sleep. Take regular food habits, meaning you should have your breakfast by around 8 to 9 a.m. in the morning. Have your due lunch at between around 2 to 2:30 and a good dinner. Do not sleep immediately after dinner. Spend time for yourself. Go for a walk. Have some physical activities. Include much of physical activity in your schedule rather than just being sedentary. Go out, play games. Just be little, and so that you are stressful. If you are all the time on your mobile, you won't be waking up. You won't be sitting here and there. You will just be sedentary. That will lead to weight gain. This is for both boys and girls. So have a lot of working, what I mean to say, do a lot of exercises. Exercises, you can just play, have outdoor games, you can play games, you can walk, go for walking, cycling. These kind of the things can be followed, and a healthy eating habits, regular spaced meals, keep a balanced distance.
You were listening, I Believe in IVF. It's not only a campaign, but a movement.
Big FM Podcast.